Hello students, welcome to chapter 64, assessment of the reproductive system. As I told you in the class, you're going to see in my comments here some that's good to know hints. So those are good for the final, hints for the final and for the quizzes. Okay, so let's start. The priority concepts of these chapters are infection, pain, and sexuality. Anatomy and physiology review of the reproductive system. So we are going to see a video right now. We are going to watch a video of the external genitalia. Let's go.
Okay, so in this tutorial we're going to take a look at the female external genitalia. So what I'm going to do is I'm going to rotate this model so we're looking at an inferior view of the external female genitalia. So the way that I'm going to explain the anatomy of this area is through a diagram. So looking at the same view, I'm going to talk you through some of the anatomical features of the female external genitalia. So posteriorly we've got the anus, anterior to that we've got the vaginal orifice, and at the front, most anteriorly, we've got the urethral orifice. So the urethral orifice and the vaginal orifice are surrounded by two thin folds of skin called the labia minora. So I've just drawn these folds on here. So the singular of labia minora is labia minus. So these are also known as the inner lips or the inner labia. So labia just means lips in Latin. So then you've got the outer lips, which are called the labia majora. So the labia majora run from the mons pubis, which is a layer of adipose tissue which lies over the pubic symphysis, to the perineum posteriorly, where they're connected by the posterior commissure. So you've got this depression posteriorly. So anterior to the urethral orifice, you've got the glans clitoris, and the labia minora form folds around the glans clitoris. So at the anterior end of the labia minora, they bifurcate to surround the glans clitoris. So this bifurcation produces two folds. You've got a lateral and a medial fold. So anteriorly, the lateral folds meet in front of the clitoris, and they form what is known as the hood of the clitoris, or the prepuce. The medial folds, however, join together and attach to the posterior aspect of the glans clitoris to form the frenulum. So the body of the clitoris extends forward anteriorly from the glans clitoris, and it's deep to the prepuce. So it's underneath the hood. So posteriorly, the labia minora join together to form the fourchette. So the area actually surrounded by the labia minora, containing the urethral orifice and the vaginal orifice, is known as the vestibule. So the vaginal orifice is surrounded by a thin membrane called the hymen. So in young girls this actually completely covers the orifice, but you get rupture of this fold of membrane, the hymen, with first sexual intercourse or through other mechanisms such as injury. So after perforation of this hymen, you get remnants of the membrane which surround the vaginal orifice. So the vaginal orifice is also known as the introitus. So also within the vestibule you've got the opening of two glands. So on either side of the urethral orifice you've got the opening of the paraurethral glands, And then slightly posteriorly and laterally to the vaginal orifice, you've got two glands which open, called the greater vestibular glands. So these glands are also called Bartholin's glands, and they secrete mucus to lubricate the vagina. So hopefully that's given you a good overview of some of the key features of the female external genitalia.
Thank you so much. This was a nice review and it was very graphic, and I think we understood perfectly. So what I'm gonna do right now is I'm gonna show the next video which talks about the internal genitalia. Okay, and instead of reading, we're going to see this video, which is going to be a good refresh.
The female reproductive system. The female reproductive organs are present inside the pelvis. It consists of a pair of ovaries, two fallopian tubes, and the uterus. The ovaries are oval-shaped structures present on either side of the uterus. They are attached to the uterus by fibrous cords known as the utero-ovarian ligaments. The ovaries, which are grayish-pink in color, are each about 4 centimeters long and 2 centimeters wide, and weigh about 2 to 3.5 grams usually. Each ovary takes turns releasing an ovum every month. An ovum is the largest single cell in the female body. After the ovum is released into the fallopian tube through the process known as ovulation, it travels down the uterus. The uterus is a pear-shaped structure, thick muscle wall. The lowest part of the uterus is called the cervix, which opens into the vagina. The vagina, a muscular tubular tract, leads from the uterus to the exterior of the body. The ovaries secrete estrogen, a hormone which releases into the bloodstream and helps in developing the secondary sexual characteristics in the female body, like the growth of breasts, broader hips, and more. The ovaries are formed from pubic hair. Progesterone is another hormone which prepares the uterus for pregnancy and the mammary glands within the breasts for lactation. During pregnancy, both the hormones work together.
Okay, thank you so much. So there was also a nice review about the internal genitalia. The most important part is that we need to remember that the ovaries are the one producing the estrogen during the reproductive years. Okay, and then when the female enters to the menopause and post-menopause period, the estrogen is not produced anymore by the ovaries, but the estrogen is coming from the fatty tissues of the female, basically all fatty tissues in the abdomen, the hips, under the arms, anything that contains adipose tissue. Okay, that is where the estrogen is coming from. Okay, so now we're gonna talk about the breast. The female breasts are a pair of mammary glands that develop in response to secretions from the hypothalamus, pituitary gland, and ovaries, and nourish an infant after birth. So for those that want to refresh a little bit about the hypothalamus, it's a structure deep in your brain that acts as your body smart control coordinating center. Its main function is to keep your body in a stable state called homeostasis. That's the hypothalamus. Breast tissue is composed of a network of glands and ductal tissue, fibrous tissue, and fat. The proportion of each component of breast tissue depends on genetic factors, nutrition, age, and obstetric history. They have abundant blood supply and lymph flow that drain from the extensive network toward the axilla. That's why when the provider conduct a physical assessment of the breast, not only palpates the breast itself, but also press on the axilla area to double check if the lymph nodes are swollen. The structure and function of the male reproductive system. The primary male hormone for sexual development and function is testosterone. Testosterone production is fairly constant in the adult male. Only a slight and gradual reduction of testosterone production occurs in the older adult male until he is in his 80s. I'm going to repeat. Only a slight and gradual reduction of testosterone production occurs in the older adult male until he is in his 80s. Low testosterone levels decrease muscle mass, reduce skin elasticity, and lead to changes in sexual performance. External genitalia of the male reproductive system. We are going to watch another video to summarize and to refresh our knowledge about this topic.
The human male reproductive system. Despite having the same main function, the male reproductive system has quite different parts compared to the female. To start with, there are two ovoid testes in male humans. The testes lie in a pair of sacs, which are pouch-like extensions of their skin between the thighs. These are called the scrotal sacs. The development of the sperms requires a temperature around 1 to 8 degrees less than the body temperature. This means around 30 degrees Celsius. This is why the testes lie in the scrotal sacs outside the main body. There is a spermatic cord that contains blood vessels at the upper end of each testes. Leading from the end of the testes is a narrow, much coiled tube, the epididymis. The testes produces sperms. The sperms may then be stored in an inactive form in the epididymis before entering the vas deferens, or sperm duct. The sperm duct from each side passes into the abdominal cavity. It loops over the ureter of that side and finally opens into the urethra. A gland called the seminal vesicle opens into each sperm duct. At the base of the urinary bladder, where the two sperm ducts join the urethra, is the prostate gland. Beneath the prostate gland is the Cowper's gland. The seminal vesicle, the prostate, and the Cowper's gland secrete a slippery fluid that mixes with the sperms called seminal fluid or semen. The semen is an important fluid because it contains nutrients and enzymes which serve to nourish and protect the sperms and activate them so that they begin to swim. The urethra is a tube that passes through the center of the penis to carry the semen to the exterior during ejaculation. The penis is an organ that contains erectile tissue with numerous blood spaces. When stimulated, the blood will fill the spaces and the penis will become erect and hard. Given enough stimulation, ejaculation or the release of the semen can happen. Urine and semen will not pass through the urethra at the same time. This is due to a circular band of involuntary muscle called the internal urethral sphincter at the base of the urinary bladder that blocks urine from coming out or flux of semen from coming in during ejaculation. The human sperm, or spermatozoon, has a head with a diameter of only about 2.5 micrometer. But exactly how small is a 2.5 micrometer? Compare it with the diameter of your hair, which is around 70 micrometer. Get the picture? You can fit 28 of these wiggly cells along the width of just a single hair. Coming towards the composition of the sperm head, it contains a large nucleus that carries a haploid set of chromosomes, little cytoplasm, and an acrosome. The acrosome is a sac containing enzymes. The human sperm also includes a middle piece containing mitochondria to provide energy for the activity of the sperm and, of course, a tail or flagellum to enable the sperm to swim towards the egg. The enzymes can break down part of the egg membranes to let the sperm penetrate during fertilization. Puberty. Puberty is the stage in the development of humans and other mammals when the sex organs mature and produce gametes for the first time. In humans, puberty takes place later in life, as compared to other mammals. Puberty begins at the age of about 12 years for boys. However, there has been a recent increase in hitting puberty at a younger age because of the artificial food given to our kids. Testosterone is the male sex hormone made by the testes that is increased during puberty and is responsible for secondary sex characteristics.
Okay, thank you so much. Very good. It was a good, excellent video. Okay, the primary male hormone for sexual development and function is testosterone. That's the most important thing that you need to remember, testosterone, okay? The external genitalia, the male reproductive system, also consists of external and internal genitalia. And you have here the graphic, but we review this on the video. Here they are basically talking about the breast, and they are showing you where are the axillary nodes and this network of lymph nodes that are across the breast. Internal genitalia of the male, the major organs are the testes and the prostate gland, as we saw in the video. Let's move forward. And here you have a very interesting picture of the internal male genitalia where you see the bladder, and here this part here is the prostate gland that we are going to speak about in chapter 67, I think. Reproductive changes associated with aging. Okay, so let's see this. These are the most important in women. For example, I highlighted the ones that I want you to remember: decreased size of the uterus, atrophy of the endometrium. When we talk about the uterus, let's remember that the uterus has a thin layer, okay, internal layer that goes around the uterus, the hollow uterus, and that is called the endometrium. So there is atrophy of the endometrium, decreased size and marked convolution of the ovaries, loss of tone and elasticity of the pelvic ligaments and connective tissues. So what are your nursing interventions? Because of these changes, especially the loss of tone and elasticity, you want to teach the patient the Kegel exercise to strengthen the pelvic muscle. And this will prevent or reduce the pelvic relaxation and incidence of urinary incontinence. And that's good to know. Notice that my comment is green, so it's related to the green. If my comment is, it will be yellow in some cases, you have to look for whatever yellow is. Increase flabbiness and fibrosis of the breast, which hang lower on the chest wall, decrease erection of the nipples. That's another characteristic that I want you to remember. Teach to reinforce the importance of breast self-examination or awareness, and evidence-based recommendations for clinical breast examination and mammography based on the patient age. These methods can detect masses or other changes that may indicate the presence of cancer. And that's good to know. Breast self-examination that will help you to detect masses or other changes that may indicate the presence of cancer. In the male, sometimes you're going to find green comments, yellow comments. It's because you want to make difference between important facts, right? Sometimes there are 3 or 4 important facts in one section and you don't want them to be all in the same color. That's why I highlighted differently. It means the prostate enlargement with an increased likelihood of urethral obstructions. Teach the signs, that's your nursing considerations. Teach the signs of urethral obstruction and the importance of prostate cancer screening. Education helps the patient detect enlargement or obstruction, which may indicate the presence of benign prostate hyperplasia or cancer, and that's good to know. Okay, health promotion and maintenance. Evidence-based practices for routine preventive screening, such as mammography and pap tests. Pap test is the same as pap smear, Papa Nicolau, cervical smear, okay? That can detect cancer early so it can be treated with better chance for sure. Assessment, recognizing the cues. In patient history, assess for chronic illness or surgeries that could affect reproductive function. Disorders that affect a woman's metabolism or nutrition can depress ovarian function and cause amenorrhea, abscess of menses. And as I mentioned in class, the good way to remember amenorrhea, the significant, the definition is A is like say adios, right? Goodbye menses. Patients with diabetes mellitus may experience psychologic changes such as vaginal dryness or impotence. Chronic disorders of the nervous system, respiratory system, or cardiovascular system can alter the sexual response, as can psychiatric mental health disorders. As whether the patient has had infection, pelvic inflammatory disease, or a ruptured appendix followed by peritonitis in females can cause pelvic scarring and strictures or adhesions in the fallopian tubes. This is very important. You see the extension of the damage if a patient of a person gets peritonitis. In female, you can have adhesions in the fallopian tubes. Salpingitis, which is uterine tube infection, is often caused by chlamydia, a sexually transmitted infection, and can result in female infertility. This is another important, it's not going to come in the test, but you need to pay attention to the sexual transmitted disease and how they can affect fertility. In this case, chlamydia can cause female infertility. A history of infections or prolonged fever in males may have damaged sperm production or cause obstruction of the seminal tract, which can cause infertility as well. As whether the patient has been treated with radiation therapy or corticosteroids, internal or external estrogen, testosterone, or chemotherapy drugs. I want to say something about this. Sometimes people are close to patients that are receiving chemotherapy or radiation and they are using the same bathroom. These are theories that need further studies, but it's good to consider the fact that if you have a family member going through radiation and chemotherapy, try to use another restroom at home. Just keep that in mind. We are still receiving evidence-based practice studies, but when the patient urinates or they are leaving some residual from chemotherapy in the restroom, and this restroom is shared for with different family members, you need to take this into consideration, okay? Still, there are studies that are being done in this sense, but pay attention to that. A history of mumps may cause orchitis, painful inflammation and swelling of the testes, which can lead to testicular atrophy and uncommonly sterility. Okay, a history of undescended testicles can contribute to male infertility. We are going to talk about all these in chapter 67. In women, a history of untreated sexual transmitted infection can lead to infertility. Assess general health habits such as sleep, exercise, and diet, and the amount of body fat that may be related to ovary dysfunction in females. Again, the adipose tissue, okay, affects tremendously the production of estrogen. Ask females about the date and results of their most recent pap test, breast self-examination, and vulvar sex self-examination. Determine when male patients older than 50 had their last prostate examination and prostate-specific antigen PSA test. As nurses, we need to reinforce our patients and family members in general that are older than 50 years old to start doing the prostate examination as soon as possible. It is treatable, prostate of the cancer, cancer of the prostate, sorry, is treatable and has a good prognosis when it's discovered in an early stage. So it's important to suggest this examination as soon as possible. Evidence demonstrates a higher risk for adverse effect associated with taking menopausal hormone therapy in women over the age of 60. Risks are lower in younger women, yet still must be recognized, particularly in women who take combination therapy, including estrogen and progesterone, as MHT has been associated with cardiovascular disease and cancer. Okay, so you need to pay attention to those menopausal hormone therapy in women over 60. Inquire whether the patient takes any vitamin, mineral, or herbal supplement, as any of these can affect reproductive system. I want to talk about the PSA test. It's a blood test used primarily to screen for prostate cancer. The test measures the amount of prostate-specific antigen in your blood. PSA is a protein produced by both cancerous and no cancerous tissue of the prostate. So that's you're going to see that test if you work in this environment, and even in primary care, right? The patient is going to have this test done after 50. Some other doctors, they will order the PSA test after 40. And I want you to remember that the PSA test is something that you must remember, and that's good to know. And also you have to remember another that's good to know, the factors that are important to the risk that are important to remember in menopausal hormone therapy in women over the age of 60, and the role that estrogen and progesterone plays in combination with cardiovascular disease and cancer. Okay, that's good to know. Okay, let's continue. Nutrition history. Fatigue and low libido may occur as a result of poor diet and anemia. The American Cancer Society estimates that 70% of uterine corpus cancers are related to overweight or obesity and lack of physical activity, rendering them preventable if people make better nutrition choices. Assess the patient height, weight, and body mass index, BMI. Okay. Women have special nutrition needs. Those with heavy menstrual bleeding, particularly women who have intrauterine devices, okay, may require iron supplements. Teach women about their body needs for calcium. Although adequate calcium intake throughout life is needed, it is especially important during and after menopause to help prevent osteoporosis, as we discussed in previous chapters, caused by decreased estrogen production. Assess for alcohol, tobacco, and illicit drug use. In males, libido, sperm production, and the ability to have and sustain an erection can be affected by these substances. Females may experience alteration or cessation of the menstrual cycle. Males and females who have chronically abused drugs and or alcohol are at higher risk for development of cancer and infection disease. Family history and genetic risk. Evidence of disease or reproductive problem in family members, if they are having diabetes, endometriosis, reproductive cancer, can be helpful in understanding a patient's current health status or risk for development of certain conditions. For example, daughters of women who were given diethylstrobestrol, DSE, to control bleeding during pregnancy are at increased risk for infertility concern. So what is DSE? It's an artificially created hormone first synthesized in the late 30s. From about 1940 to 1971, the medication was given to pregnant women in the incorrect belief that it would reduce the risk for pregnancy complications and losses. However, it was later discovered that DSE is an endocrine disruptive chemical that interferes with the endocrine system and can potentially cause cancer, birth defects, and other developmental abnormalities. Thanks God it's not available, but the side effects are still present in some generations. So if you're a daughter of women who were given this medication, probably you're gonna have increased risk for infertility not only in your generation but the generations after. Think about that. Consider that factor. Assess in your family who was given this medication in those years. A specific BRCA1 and BRCA2 gene mutations increase the overall risk for breast or ovarian cancer. Men with first-degree relative, like father, brother, with prostate cancer are 2 to 3 times with the risk for development of the disease than are men in the general population. Also, you need to check for current health problems. Heavy menstrual bleeding or a lack thereof may concern the patient. The possibility of pregnancy in any sexually active woman with amenorrhea must be considered. Postmenopausal bleeding needs to be evaluated. And that's good to know. Bleeding in postmenopause is a no-no and should be reported and evaluated. Ask the patient to describe the amount of characteristics of any abnormal vaginal bleeding. Assess whether the bleeding occurs in relation to the menstrual cycle or menopause, intercourse, trauma, or strenuous exercise. So this is the best practice for patient safety and quality care. Assessing the patient with reproductive health problems. You see bleeding, presence of bleeding, discharge, amount and character of discharge. It could be G's, which is thick, white, clammy vaginal discharge that usually doesn't smell. The discharge might also have a creamy whitish coating from Candida albicans, cottage cheese appearance. Also, as I explained in class, you don't want to meet Gigi. You don't need to know who Gigi is, which is related to the green discharge in gonorrhea, Gigi. Mushroom-like odor, and it's caused by the Neisseria gonorrhea bacteria. It's an STD. For male patients, ask about the presence of perineal bleeding. Ask any patient who has abnormal bleeding about associated symptoms such as pain, cramping, or abdominal fullness, a change in bowel habits, urinary difficulties, and weight changes. Okay. Masses in breast, testes, or inguinal area must be evaluated as if the patient can relate the changes in character or size or of masses to menstrual cycles, heavy lifting, straining, or trauma. Ask about associated symptoms such as tenderness, heaviness, pain, dimpling, and tender lymph nodes. So let's stop here and let's take a break, and then we'll come back with the final part of chapter 64.